Hello and welcome dear learners to the NPTEL course on Healthcare Quality Management, Infection Control and Patient Safety. In today's lecture 23, we will be seeing in the part 2 the defining concepts of the scope of the standard treatment guidelines that we have studied in the previous chapter. And how are these guidelines established? And what are the essential characteristics of these guidelines? When we define the scope of these guidelines, we need to think on like the reach of the clinical guidelines, which can encompass a wide variety of topics within the healthcare. Suppose when you address a specific health condition and their associated manifestations such as migraine or vertigo, the guidelines can cover proactive health measures including vaccination and prenatal care. Vaccination replacing immunization and prenatal care replacing antenatal care. The focus can be tailored to a particular segment of the healthcare system: primary care, secondary care, and tertiary care. Primary care, general community based healthcare. Secondary care, specialized services often in a hospital setting. And tertiary care, which is highly specialized and complex medical services. And quaternary care actually after that will be for a research purpose. Alternatively, the scope may be defined by the location where they are applied. Might be to a specific facility such as a hospital or a defined geographical region or area. Basics for the development. When you come across the guidelines are formulated by considering the several key factors. They address the common clinical presentations encountered in the practice. They account for the expertise and competencies of the healthcare professionals who will use them. They are adapted to the infrastructure and supplies accessible at various levels of the healthcare delivery system. How were these guidelines established? When we are trying to understand the establishment of the treatment guidelines, it is through a process that requires a time and effort, especially in achieving professional agreement. Disagreement among the prescribers are common, and particularly when developing recommendations intended for a diverse range of practitioners. Some of the steps that we can see when we are formulating these guidelines are: 1. Where establish the oversight body. A dedicated group of people who must be assigned to be mandatory preparing the protocols. That is called as Drugs and Therapeutic Committee. The hospital setting, this task is often assigned and they work on that and they executively put or delegate this work. This is the panel which works actually for this part. Second step is the creating a structural plan. To ensure timely completion, a comprehensive development plan with a precise schedule and deadline is very crucial. Prioritize the health condition. Each potential subject must be assessed based on local health requirements and the anticipated financial outcomes. What is the purpose? It should focus on high risk burden diseases, high risk diseases, and potential epidemics. The primary objective is to standardize the clinical practice to reduce variations, thereby lowering the overall cost and improving the patient outcomes. Even the conditions that do not significantly affect mortality or morbidity, such as dermatological diseases, may still be prioritized if their management consume a substantial portion of the medicine budget. Define the scope. The scope must clearly state the target group and the healthcare context, as well as many population excludes it. Standard treatment guidelines can be categorized by their breadth. Protocol for one major health condition, malaria, community acquired pneumonia, stroke. Protocols for limited number of high priority conditions, often focusing on areas like maternal and child health. Protocols covering numerous conditions across all levels of care. While beneficial for coverage, overly comprehensive guides may be less convenient for quick reference than a concise manual. Determine the treatment protocols. This is the most vital step, requiring a reliance on a robust scientific evidence rather than a simply on historical practice. We need to see that what are the proposed treatment options should be confirmed through consultation with clinical experts. Guidelines must be consistent with the existing national or regional policies and no doubt with the drug formularies. Generalized prescription principles use the smallest number of medicines necessary for efficient treatment management is very important. Primarily select medicines from the essential medicine list, that is EML, or the local or national formulary. The team needs to see that the EML, if it is absent, one must develop based on the recommended treatments. Choose treatment that offer the best results for the expenditure. Each medicine should be evaluated based on its efficiency, safety, profile, availability, cost and quality. Include options for first line, second line and third line treatment when clinically it is being found it is appropriate. Provide a complete prescribing information including the dosage, the duration, the contradictions and even the potential adverse effect. Without that it will not be fulfilled. Structure the content part. The STGs manual should be brief but contain all necessary information for managing the condition, ideally fitting into a practitioner's pocket. They can carry it, they can read it, they can follow it up. What are the requirements necessary? Name of the disease, its pathophysiology, the diagnostic criteria, including relevant laboratory investigation. Avoid extraneous details, rather not required for clinical decision making. Clear the goals for the treatment. Example, pain management, infection, elimination, fluid resuscitation, blood pressure control. It should also include patient education. It should also provide that helps both the patient as well as clinician to understand the illness, especially the prognosis part and methods for prevention, with the help of the warning signs. The team needs to review and pilot the test. They need to work on the feedback that has come actually with respect to the scientific content. The overall presentation should come up with the usability and the steps for gaining more commitment and adoption for the final protocols need to be cleared up into this review part. The publication and dissemination comes as a final. When it is approved, it is to be published and it should be officially launched. They need to emphasize on giving more individual copies to the users. Training session should be done and monitoring and evaluation for the prescribing behaviors need also to be one of the important part of this. Do we expect regular revision and updating? Yes, it is. Guidelines must be updated periodically and we need to integrate new evidence-based treatment. Protocols quickly become obsolete and many times you may find that people are compromising with the patient care. They undermine the credibility of the entire system and that's where the revision is very mandatory. Essential characteristic of the STGs. Simplicity and clarity in the protocols should be easily to follow and focus only on priority health conditions. For each medical issue, include only clinical manifestation and limited set of diagnostic criteria. Provide explicit and straightforward recommendations for both non-pharmacological management and pharmacotherapy. Credibility and evidence base. The guidelines must be trustworthy to encourage adoption. Protocols should be formulated with respected experienced clinician and founded upon strong evidence which are very scientific. Updates and revisions should incorporate feedback derived from real world experience rather not just coming from the clinics. The prescribers and the allied health professionals also need to put up their experiences and this should be coming from all the feedbacks. Acknowledge practical challenges which are to be faced by the physicians over there. Uniformity across care level. There should be emphasis on consistent standard of care which is must to be maintained for a specific condition regardless of the settings. Healthcare professionals include physicians and other providers must also adhere the identical standard treatment for the given set of diagnosis of the disease condition. The choice of the treatment must be based on the severity or the nature of the condition, where you can say the presence of septicemia in the diarrhea or the dehydration degree rather than where the patient first sought care actually. Whatever is there actually with your availability rather than actually making the first line therapeutic option, regardless of the type of healthcare facility it is or the individual provider's level of expertise. So uniformity across the care levels is very important. Alignment with medication supply. This is with respect to the supply chain management actually, where you may find the impact on prescribing habits. The available drug stocks must directly correspond to the treatment recommended in the guidelines. And even the necessities a new pharmaceutical agent. Procurement part needs to be updated and included actually. Integration into the professional education. We need to see that the STGs keep a foundational phase and are to be introduced with respect to the professional development and in the pre-servicing training to all the new healthcare workers who are to be inducted for this. The ongoing use is reinforced and supported by consistent in-service training programs for existing staff also. Dynamic updates need to be there. Periodical update is very much important and need to be incorporated with evidence and recommendations. Adjustments are made based on the factors such as drug resistance pattern and safer or more cost-effective alternatives which are to be entertained a lot. For optimum usability by practitioners, standard treatment guidelines are published by compact, robust manuals that can be carried easily. So in the last to this chapter, I would like to emphasize more on STGs that are a very formal statement which are intended to help practitioners making an evidence-based informed decision for specific clinical conditions. The scope can be seen in clinical, can be seen in all level of care irrespective of the geographical area. It should go through the development process. It should emphasize more on prioritizing the condition. Treatment protocols must be determined using robust scientific evidence, consulting clinical experts, which comes from national policies because the information is also being taken from formularies and prioritizing actually the cost-effective and essential medicine. The content should be concise, outlining the pathophysiology, clearly the therapeutic objectives, reviewed, pilot tested and officially published. And it should be adopted by all the clinicians. To remain effective, always the standard treatment guidelines require a continuous alignment with respect to the drug supply, integration into training programs and mandatory revision which will reflect the new evidence and maintain the credibility part. In the end, I would like to say that the STGs must be simple and clear, focusing on only the priority conditions, the key diagnostic criteria and explicit non-drug and drug recommendations. To make it more successful, you require uniformly taken it across all level of care and the credibility derived from the strong evidence and validation. And to remain relevant and functional, STGs need a dynamic update based on the new evidences. And the new evidences must be aligned with the drug supply system. They need to mandatorily integrate into both pre-service and in-service professional educations. Then and then only you may find the major benefits of these STGs can be taken by the employees. So with this we come an end to this chapter which has these references to be taken whenever you are trying to work on developing the standard treatment guidelines in your organizations or you are working in a team who is taking ahead this responsibility. So thank you for that.